Hi, everyone. Thank you so much for joining us today, and thank you for sticking with us. Sorry for the late start here, but really excited to be here with you all. My name is Taylor McPartland. I'm the CEO of Scale Health. And Scale Health, really quickly, is a health innovation ecosystem and marketplace that basically works with amazing innovators and entrepreneurs like yourself that are dedicated to tackling big systemic problems in the healthcare industry. And we work with amazing health organizations like the Inland Empire Health Plan that we have the pleasure of partnering up with on this really exciting challenge. This webinar here today is the first of 4 that we're going to be running, each one dedicated and focused on one of the 4 topic areas that we're targeting for this particular challenge. And so today we're going to be talking about child and adolescent well care visits. And it's an amazing opportunity for all of you that are participating in the challenge or curious to learn more about the challenge to hear from our amazing partners over at IEHP, ask them questions about kind of what they're how they're thinking about child and adolescent well care visits, and also ask us at Scale Health questions around the challenge itself. We're here to make sure that you have an amazing experience, and we're here to make sure that we're able to surface the most brilliant and impactful solutions to address IEHP's goals here. So with that, I'm going to step aside so we can get the program rolling, and it is my great pleasure to invite up to the stage Jeff Pierce, the Director of Innovation and Acceleration at IEHP.
Hey, thanks, Taylor, and good morning, everyone. My name is Jeff Pierce. I'm privileged to be the Director of Innovation and Acceleration here at IEHP. My role here, among other things, to foster innovation, bringing internal, external, innovative thinking with companies such as yourselves, to also bring a repeatable discipline to fail fast, learn, grow towards quality care and health outcomes for our members. For a little background and context, IEHP is a mission-driven organization to heal and inspire the human spirit. It launched in 1996 with only 62,000 Medi-Cal members. Since then, it's grown into the largest not-for-profit Medicare, Medicaid plan in the country. Also, ISP is no stranger to innovation over the past several years, winning awards for certain initiatives and programs that bring our mission, vision, and values to life. Programs such as community health needs and navigation, identifying top needs across key at-risk population sets, providing health navigators to support connecting those populations with key community services in the area. This particular innovation challenge is brought about because we strive to continue our commitment to the members, providers, and partners, and each other. So this challenge, it's an opportunity to expand on the foundational components that this organization has already set, as well as bringing new thinking, problem solving to the table. So we really look forward to your contributions. Quality of care, as you heard Taylor mention, is a major focus of ours, and you'll hear about that in part in today's discussion. I'll leave you in the hands of our mediator, our medical director, Dr. Glenn, in a moment. But before I do, I want to highlight a couple of our values that I ask that we stay focused on. Number 1, placing our members at the center of our universe. And number 2, unleashing our creativity and courage to improve health and well-being. Thanks, everyone. And with that, I'll pass it back over to Taylor.
Amazing. Thanks so much, Jeff. And as Jeff mentioned, one of the things that I'm just beyond impressed by is IEHP's dedication to their mission, vision, and values that they live every single day. And we'll be hearing more about that here in the next 45 minutes. But with that, it's my pleasure to hand the mic over to my colleague, Scale Health's Head of Partner Success, Kat Karimi, who's going to be our moderator for the day. Kat?
Great. Thank you, Taylor. Thanks for everyone joining us this morning. We have an exciting program ahead of us. It's with my distinct pleasure to introduce Christine Ewan, who is the Medical Director of the Inland Empire Health Plan. Christine, thanks so much for joining us. Just to set the stage for how the next 30 minutes or so we're going to go. A lot of this will just be a conversation back and forth. However, I did put it in the chat that if anyone has any questions that come up during our conversation, please feel free to drop your questions in the chat. And towards the end of the webinar, we will be doing a Q&A with Christine and the other members from IEHP who are on this call as well as folks from Scale. So with that, good morning, Christine. And why don't we start out with you just telling us a little bit about yourself and your role at IEHP?
Hey, thank you so much. Thanks for having me here again. My name is Christine Nguyen. I'm the Medical Director over Quality Transformation. I work very closely with Jeff and the innovation team. And in this role, we're really thinking through how do we best deconstruct some of the challenges, but also opportunities to be able to better support and serve our members. Again, we're a mission-driven organization, so that's at the heart of what we do. And really looking ways for innovative and creative ideas, either internally or also ways to partner with the external organizations as part of this design challenge in order to better support our members and deliver the care that they need.
Great. And so in your role as a medical director, how do you typically think about working with innovators?
Yeah, and I also just want to confirm, is my audio okay? I heard from somebody in the chat that the audio is a little bit muffled. And Spy, are you able to hear me okay, Pat?
It is a little, there's a little bit of an echo.
Okay. All right, let me, I think while you're talking in the space in between, I'll likely switch to my phone to see if that's a little bit better. But yeah, so I think in terms of working with innovators, says can't hear muffled. Kat, would it be okay if I switch over to my phone and see if that may be more helpful?
Sure. Yeah, we want to make sure that folks are able to hear you.
Make sure we can hear. Okay. All right. Give me just a moment to do that. Thank you for letting me know.
Thanks for your patience, everyone. We want to make sure that everything that Christine has to say is heard by all of you joining us on the webinar. So just be another minute.
Hi, is this better now?
I believe so, yes.
Okay,
Yes.
all right.
I'm seeing some head nods, yes.
Yeah. All right, so yes, thank you very much. So I think in terms of as a medical director, I think for us it's always looking to partner with innovators for, and I think for one, a shared sense of purpose in order to help and support the communities that our members reside in. I think that that's very important first and foremost. And then secondly, it's thinking about complementary capabilities. There are things that we have at IEHP, we really try and do so much for our members, and there are quite a bit of resources that we have here internally, but we're also looking for complementary capabilities, new and different ideas, creative ideas from folks not a part of IEHP that we can hold hands and work together in order to join forces and then support our communities and our membership base.
And that's fantastic. And I'd love to dig into that a little bit more once we have an idea of some of the challenges that you're facing specifically with this innovation challenge. But before we do that, the topic of this webinar is around child and adolescent well care visits. So let's make sure everyone has the appropriate context. For anyone who's not familiar with well care visits, what does that mean? And if you can, I know we have a slide we can put up on with the definition, but again, kind of for folks who are not familiar, there are specific HEDIS measures that we're addressing with well care visits. So if you could just kind of speak to the definition and the HEDIS measures that you're addressing, that would be great.
Yes, thanks. So I think a little bit of context. So I think just to set some context around this particular measure, I think just to pull us up a level, as you are developing, when you're young to when you're adult and even into your adult years, you want to make sure that you are receiving the appropriate preventive visits in order to ensure that you are hitting some of those milestones, that you are, your vision's correct, you're receiving the appropriate immunization, or your developmentally, you're developing appropriately, physically, mentally, emotionally, all of those things. And those are things that can be covered in a preventive well visit to make sure that you kind of catch those things, and make some appropriate interventions to care for the members holistically, so that they can grow up and live really full, happy lives and healthy lives. And so the recommendation is that, between the age of 3 and 21, that you have at least one of those comprehensive well care visits with a doctor, so a primary care provider, which can either be a family practitioner, a dental practitioner, pediatrician, et cetera, or an OBGYN during the measurement year, which measurement year just applies to the year and, the beginning of that measurement year. And so for this specific measure, it's usually January to December.
Okay, thank you. I think that's really helpful for folks to understand. And with this innovation challenge, this category specifically, IEHP is interested in a subset of the child and adolescent years. Can you speak to that and why that was important for you?
Yeah, I think overall we care about each of our members, but there is a particular subset of members that we're noticing that aren't utilizing the preventive care services as much as some of the other age groups. So if you can see in this diagram here, overall, about 52% of our members did not meet measured criteria, which means that they didn't go in to receive at least one well care visit the last year during 2022 with a PCP or an OBGYN. When we did a double click on that 52%, you'll see on the right-hand diagram that depending on the age group, there's some age groups that are not receiving the recommended care relative to other groups. So between the age of 3 to 11, it's about 26% of those members that didn't receive that recommended well care visit. 36% of the members are between age 12 to 17, and then 38% is between age 19 to 21. And I think for the focus of this design challenge, we want to identify ways to better support the members who are between the age of, and I think that there's a little bit of a typo there. It should be age 18 to 21, not 19, or 18 to 21, to be able to better support those members so that they can receive the recommended care.
And then and thank you for that. And I think we might have one more slide here around the, let me see, additional data that we had. Maybe not. So
yeah,
as you,
I think we do have some additional data here. So
right, yes, the utilization slide. Thank you.
Yeah, so when we do double click on that 18 to 21 age group, we'll notice that 48% of those that population did see their PCP in measure year 2022, and then 25% did not have a PCP visit. And then among that group, you'll notice that there are different utilization patterns for the members that did not see their PCP, where were they utilizing and engaging with the health systems in different ways. And you'll notice that a little over than 21% utilize urgent care, utilize emergency departments. So that utilized care should actually be utilized emergency department. The second bullet, that's a little over than 21% utilize urgent care. And then the last subset, a really large volume of them, 57% did not utilize any care at all. And so when you think about the age group between 18 and 21, oftentimes, I think if you're between this age, you're a young adult, you're just for the first time kind of learning how to take care of yourself and you're on your own without your parents making those appointments for you. You may be juggling school, you may be juggling a job at the same time. So a lot of things going on. And so, there are competing demands on folks in this age group, especially, when they're learning how to just start to be and living independently on their own, that if you're young and you feel healthy, that you're less likely to be able to engage in that care unless you're very, very sick. So, we still want to make sure that, I think your physical, mental, emotional health are all going well. And so it's important to be able to receive that recommended well care visit, and even in this age group. So I think we'd love to be able to find ways to better engage and support this age group so that they can receive that recommended well care visit.
Yeah, thanks for that. And I would imagine, I remember being, I don't want to date myself here, but yes, being on your own and whether you're off to school or other obligations and distractions, it's not necessarily focused on, if you feel well, right? And so what do you see as some of the risks for young adults in this age group at 18 to 21 in not participating in regular well care visits?
Yeah, I think it's I think connects to some of the things that we've alluded to before. We want to make sure that it's a comprehensive exam. We want to make sure that we care for our members holistically. That's physical, mental, emotional well-being. And so in that visit, we'll be able to understand some of the challenges and also opportunities to better support them as they're going through this new chapter in their lives.
Yeah, and in addition to some of the reasons that you've already talked about, in your experience, are there additional reasons for missed or delayed well care visits other than perhaps just feeling well or being on their own for the first time?
Yeah, and I think that's something that we'd love to be able to partner with the innovators on. In our claims and encounters data, we're able to see whether or not the member did or not receive the well care visit. I think we can get an understanding of the breakdown of the demographics of this population. But in terms of the core reasons why, I think that's something that we'd love to learn more about. I think we have some ideas or some hypotheses that we're working through, which could vary from many different reasons, right? A part of it is learning how to manage your self-care, for the first time, being a young adult. Could be because you have competing priorities, job, work, school, other things, making time for friends and family, other things that might be prioritized over a well care visit. Oftentimes, you may be in a position where you aren't able to take time away from your day because you have commitments or obligations that are necessary for school or for work or for other activities that doesn't allow you to actually make it to a doctor's office in time during open hours or during times when they have appointments available. So there could be so many different reasons, and we'd love to be able to partner with the innovators to really understand some of the key challenges that this group may be experiencing and identifying ways that we can help bridge some of those barriers and help support them.
That's really helpful to understand. And given that you are looking to partner with the innovators to determine some of these core challenges for the this particular age group, what can you give us an idea of what data IEHP would be able to potentially provide to a pilot partner? as they develop, as they're filling out their submissions and thinking about how they can support IEHP around this particular category. Yeah, any additional context there would be helpful.
Yeah, I think for the innovators or the teams that do go on to the upcoming rounds, and then are kind of in that stretch, that journey with us, that innovation journey with us, I think that there are ways that we can provide some additional insights around high-level demographics around this age group, and to be able to help support, geographically, where do we see most of this happening? And so that sort of detail can help us narrow and focus in on the solution that we designed together and in order to help support this population of members.
And I would imagine for, this is largely an engagement challenge, right? And so would some of that data potentially include information, or is IEHP currently gathering information around emails and cell phones and communication preferences that innovators would be able to leverage in deploying their strategies?
Yeah, thanks, Kat. So I think for some of those things, if we have information around that may be helpful, I think we can help provide a high-level summary of, in order to help the innovators understand what types of access or touch points may be, or communication channels may be available to be able to have the widest reach in terms of engagement with this population of members. And so all of those things we can look into and then go from there.
Great. I have a couple more questions, and I see a lot of questions in the chat as well, so I want to make sure we have time to address those. So in your experience as a medical director and working with innovators and really with companies with whom you can partner, what type of solutions are you looking for, or is there maybe a wide breadth of solutions that you guys would be open to working with? And I mean from either the engagement platform, or someone that can help on the data side, or is it a combination of all those things?
Yeah, it's really a combination of all those things. I think, as we've shared in the design challenge questions that went up, and to provide some guidelines for our innovators, I think really we're looking for ideas and solutions that not only help us engage this population of members, but also, right, because I think engagement is the first step, but also how do you engage the members so that they do follow through and receive the recommended care? And then how do you ensure that once that recommended care is received, how does that information circle back to IEHP so that we can feel reassured that the members have received the recommended care, and that they're getting what they need in order to live healthy, happy lives? And so I think that those are kind of high-level key milestones in terms of the solutions that we're hoping to get.
That's great. Thank you for that additional context. I think it'll help the folks on this call and other people interested in applying for this or submitting to this category to understand kind of the scope of what this challenge really entails. And just to recap, I've heard you mention a desire to better understand this demographic, right? So using the data, or generating data to better understand this age group specifically. And then once you have the necessary information and data around this age group, identifying engagement tactics or strategies that not only inform them of their well care visits and the importance of maintaining preventative care, but actually attending those visits, and then that feedback loop back to IEHP. Did I capture that correctly?
Yeah, you did. And I think, we're looking for creative ideas, right? An example does the member come to the care, or does the care come to the member? Right? Like, we're looking for different ways to really get at the heart of what are the biggest challenges and also biggest motivators for these members to be able to receive that recommended care. And so that we can design a solution around that. And that solution is able to have a closed loop communication, not only with the members, but with IEHP, so that we have an understanding that the member did receive that care. And also for that subset of members within the 18 to 21 age group, kind of what actually worked. What are ways that actually demonstrated the ability to really connect with those members and help them kind of follow through that recommended care journey.
Right. So something ideally that would have a measurable impact. And so understanding to some extent what the baseline would be, and then be able to demonstrate an improvement over that baseline. Okay, I think that's really helpful. And I know there's going to be some follow-on questions on this as well. But before we get to the Q&A, given that the intent around these webinars is to really have a first-person account and perspective from leaders at IEHP around what the pain points are specific to IEHP, and more importantly, what is important for IEHP in working with the community, working with innovators, working with startups. So with that, I would love to touch on, and Jeff touched on this earlier at the top of the webinar, but IEHP mission, vision, and values. If you can speak to this just a little bit and help us understand if there's anything that startups should be aware of when possibly working with IEHP.
Yeah, I think Jeff did a really good job of providing some color into this at the beginning of this call. But I think it's really our members are at the heart of what we do, and everyone here at IEHP really cares and takes pride in the work that we do to take care of the members and us take care of each other. So I think in terms of quality, we want to make sure that the members are receiving not only the recommended care, but at the best quality possible, so that they're getting the care that they deserve in order to live those healthy, happy lives. I think health, I think the next one, I think that alludes to the next comment around health is about living vibrant, healthy lives. I think that's getting to kind of the spirit around the preventive visit is how do we ensure that those members are receiving the services necessary to be able to prevent some of those, to prevent some of that sickness from happening earlier on. Is there a way that we can intervene earlier, which is really an important part of that preventive visit so that we can take care of the member holistically, and then ensure that they're able to live that vibrant, healthy life. And then last but not least, around equity, we're very passionate and it's very important to us to ensure that we address health disparities throughout the organization and in our communities. And so we want to ensure that we can actually build on some of that organizational strength, some of those capabilities that we have in-house, and really partner with the innovators to provide some of those complementary set of solutions to be able to partner together, combine forces, and really support our members so that they can receive the recommended well visits.
Thank you. That's fantastic. And it's just been an absolute pleasure working with IEHP, given that our mission, vision, values align around healthcare and well-being so much. And, obviously there's the cultural fit that, for a startup or a company to work with an organization like IEHP, that's of the utmost importance. But then, also to make sure that they're actually addressing the pain points, right? So if we can get that sense of combination, I think we've really kind of knock this out of the park here. Of course, given the nature of the organization, there are concerns and requirements around HIPAA and compliance, InfoSec or information security. For everyone who is going through the assessments, if you've had an opportunity to do that yet, you'll see that there are specific assessments related to those categories, because as you might imagine, a very large health plan like IEHP, that will be important for any company that works or pilots with them. So just to call that out as part of that process. And so before we jump over to Q&A, there's some really great questions in here. Any last bits of advice or final thoughts for participating startups?
Yeah, absolutely. I think something to consider is, you know, we have a lot of different parts of the healthcare system. You know, we have kind of different buckets. We have the members who are receiving the care. We have the providers who are helping us deliver that care. And then we have IEHP that's here to ensure that there is a mechanism to allow us to all work together in order to provide those sorts of services to our members. And you know, we want to ensure that the solution that's designed, that there is integration across all three buckets, to ensure that the information and the communication channels are connected from the members across the providers and back to IEHP, so that we can all work and function as a cohesive unit to take care of the members who reside in the communities that we support within the San Bernardino and Riverside counties.
Got it. Well, thank you so much for the conversation. I think we provided at least a foundational context for everyone who's interested in this category. And we are recording this webinar, and we'll be able to reference anything in it for folks who may have missed parts of it. I want to start going through the questions, and in no particular order. I'm just trying to bucket them in different categories. So the first question is, is there a PhD degree requirement for this challenge? And I think I can answer that. And there is no requirement for any degrees, any types of degrees for this innovation challenge. We are really looking for folks who can come up with an innovative idea that can actually help address this particular pain point and in an impactful way, right? So, we definitely want to, and this is stated in the assessments. It is strongly encouraged for you to provide case studies in the event that you have experience with any component of what we've talked about here, right? Whether it be understanding the demographic or this age group, and helping IEHP better understand some of the challenges around engaging this age group, getting them to their appointments, or that feedback loop, the actual engagement, or that feedback loop back to IEHP. So, it's not required, but it is strongly encouraged to provide any relevant case studies or experience with any part or any component of that process. So I hope I answered that first question. That was an easy one. This is kind of going into the data, diving into the data a little bit. Do you see any difference in gender when it comes to adherence to the WellCare visit?
Yeah, I'd have to go back and take a look at the demographic breakdown and a little bit, but I think utilization patterns certainly vary depending on the age group. But I think we've just kind of seen kind of similar distribution across the groups, but can certainly circle back with that with this group on that information.
Okay. So I think we may have addressed this one. What are the current challenges or hypotheses why there's a shortfall? Is it an access barrier, et cetera? Also, is mental health or well-being part of this?
So I think if we're sticking to the measure definition itself, I think we want to use that as a foundation for this specific design challenge. And I think it's really around the child and adolescent well visit, preventive well visit between the age of 3 and 21. In that well visit, right, it's a comprehensive well visit, so we'll include things that will help care for the members physically, mentally, emotionally. It's not specific to one particular thing, but it's a comprehensive well visit exam.
Understood. And I think, just to address the top part of this, we talked about the various reasons why, or hypotheses around why members of this age group are not attending their WellCare visits. One thing we didn't talk about is access barrier. And so are you seeing any, and this is actually coupled with another question. One, is IEHP collecting SDOH data that can further inform some analytics around this demographic specifically? And as a kind of a part two of that question, are you seeing any or hearing any access issues or challenges that may be part of the reason why they're not participating in their WellCare visits?
Yeah, and thank you for bringing that up, Kat. And I think it's a two-part response. One is we do have some information around social determinants of health, because again, addressing health, making sure that we address health disparities is very important to us. And so we actually, when we do connect with our members as part of their enrollment, I think we do try and assess to see if they do have any barriers that may impact their ability to access care, and we do try to provide resources to help support those members. So that is a part of a part of our culture and a part of what we do here at IEHP. And I think in terms of some of the key barriers and challenges for this group, I think that's something that we alluded to earlier. We'd love to be able to understand what the key challenges are for this group, because we do have some high-level understanding, but I think as part of the design challenge is really understanding that end user, this population of members that are not accessing the WellCare visits in the way that is recommended. Is how do we better understand the core barrier, the core challenges, and it may require the interviewers to go out there and do some interviews and have some conversations with people who do fit a similar demographic to see what those challenges are, so that we can design a solution around that to better support this population of members.
Yeah, no, I think that's helpful for folks to understand too, right? That there may be a subset of data that's provided by EHP. And I want to be clear, this is the data that's been provided either already on the challenge website or in this webinar is what's provided to everybody. When we talk about the additional data that IEHP may be able to provide, that's specifically for the finalists and folks who may continue on as a potential pilot partner. So I just want to delineate for folks. There are some assumptions that you can freely make in developing your solution and submitting your submission. And if there's specific data that you would need, either you can get that directly from IEHP if it is available, or as Christine just mentioned, you may, as part of your solution, go out and procure that data. So just wanted to call that out as far as kind of the availability of said data. Now we have a couple more questions. I'll get to some of the challenge logistics questions towards the end. There was another one. Did I miss anything? Along the same lines, just to kind of round out. So there's a question here. What models are you considering in partnering with innovation partners? Is there budget obligated in IEHP for acquiring solutions? And so as far as the challenge goes, the potential prize, if you will, is around pilot and partnership opportunities with IEHP. So that's kind of where the challenge ends. But if it's, I'll let IEHP speak for any potential beyond that. But I think it really would be on, an ad hoc basis and not part of this particular innovation challenge. And specific incentives that are not. So this is an interesting question, and I don't know if you know the answer to this, Christine, but the last one we received was, are there specific incentives that are not allowed when working in a Medi-Cal or Medicaid organization?
Yeah, I think that there are some guidelines on which, types of incentives. So usually when we do develop programs around member incentives, we actually submit to DHCS in order to ensure that, we are following all the rules around some of those guidelines. And so that's kind of where I would redirect folks to in order to do a little bit of reading around that. So I think the particular language I don't have exactly memorized, but there are guidelines that we follow to ensure that we are doing the right things for our members.
And I encourage, if you haven't already, everyone on this call, to have a good sense of the scope of the Inland Empire Health Plan, one of the top 10 largest Medicaid health plans in the country. So definitely, I think that's a very appropriate question, given the nature of the organization. I think I got to all the questions. If I did not get to your question, please resurface it in the chat. I think we were able to get to everything. What I would love to keep an extra few minutes for is to highlight the logistics around the challenge. So Christine, thank you very much for your time. Really appreciated the conversation, insights for IEHP. It's fantastic to afford the opportunity for the innovators to have this firsthand experience and conversation with you, and to understand more around the challenge and your pain points at IEHP specific to this category. So thank you so much. Really appreciate your insights. If we can bring Taylor back on.
Hello.
Taylor, would love to hand it back over to you. There's some questions around the innovation challenge itself. Some of the questions around the timeline, how can you find more information about the challenge, and kind of next steps. So if you wouldn't mind providing that for our attendees here, and just want to thank everyone for attending. Thank you.
Absolutely. Thank you all. I know we have a bunch of questions along those lines. We can definitely touch on a few while we're here, but we're also saving them, and we'll follow up with everyone via email if we're not able to get to a question here in the last few minutes. But the challenge is live for the next, I believe, 3 weeks or so. It's a 4-month challenge overall. We'll be doing 3 more of these webinars, one each week, highlighting a different aspect of the challenge itself. In terms of participation, and getting involved in the challenge, we have in the link right here the ability to, thank you, India, the ability to join the challenge and participate if you haven't already. Once you're in the challenge, please make sure that you complete all the aspects of the assessment. There are several compliance and regulatory categories, as well as this IEHP specific category. We want to make sure that you fill out each one of those to best present your idea, your solution for this challenge when it's all said and done. We will be continuing to accept new participants over the next few weeks, and so if you know anyone that's interested in getting involved, please make sure you share that link with them. And we also will be sharing in the chat here the Eventbrite to sign up for next week's webinar as well. So you'll be able to hear from more members of the IEHP team, more members of the Scale Health team, and continue to, as you dive deeper into the challenge and as more questions come up, we'll be able to answer those there. If any questions come up between now and next week, we're available as a team. There's a number of ways to contact our team members in the challenge itself. Through the link process. You can also email us directly at contact@scalehealth.com, or you can email me directly at taylor@scalehealth.com. Seeing a couple of questions here. The specifics, Vikram, the specifics of the timeline are on the landing page there that India just linked to. Perfect. And yeah, all the other questions we'll be able to get to. We'll follow up and answer individually. But again, thank you all so much for joining. We're just about at the top of the hour. But thank you to Christine, to Jeff, to Kat for moderating, or India for producing on the back end, and really looking forward to your involvement over the next few weeks. I'm excited to see more of your solutions, and hopefully looking forward to seeing you at next week's webinar as well. Thanks, everybody.
Thanks, everyone. Thanks, Taylor. Thanks, Kat. Thanks, Christine.
Thank you.